a greater share of national spending from the current one-third to about 40% to help reduce the impact of rising healthcare costs. This was just one of the major policy shifts by the government to give Singaporeans a greater peace of mind. Also being reviewed is MediShield Life, a scheme that offers all Singaporeans, even those with pre-existing conditions, universal coverage and better protection for large hospitalization bills. But premium affordability remains a concern.
For the MediShield insurance, there's always this component called the deductibles, after which there is also another small component called the co-insurance, whereby all these, the deductibles as well as the co-insurance are actually paid for by the patients themselves before insurance comes in to pay the rest of the portion. So if we are able to cut down this component of co-insurance and deductibles, then the out-of-pocket expenditure or even through MediSave deduction can be lowered and people can actually feel that it's actually more affordable.
The expansion of MediSave to cover more medical conditions will also be studied.
If we are able to liberalize the use of our CPF MediSave account for certain conditions, then that will give Singaporeans a sense that healthcare can remain affordable. In addition to that, I think government should also look into increasing the subsidy, especially for the lower income families.
Another area of concern was the demand for elder care services in light of Singapore's rising aging population. And while initiatives are underway to ramp up infrastructure, services and manpower, experts say that the community has to play a more active role in caring for the needs of the elderly.
We have a huge pool of untapped talent in terms of those who have retired, housewives, who can come forward and provide a certain amount of hours of service. And I don't think we should look to have people in the house 24 hours, 7 days a week to look after the older person or the person who's disabled.
Mr. Udairam added that there should be more awareness of what's available at daycare centres and senior activity centres instead of just opting for nursing homes and public hospitals to care for the elderly.